Hi, I'm Dr. Thad Deal, and in our office, our focus is on chronic, difficult to treat health problems and conditions. On this video today, I want to talk to you about irritable bowel syndrome, ulcerative colitis, and Crohn's disease. While they differ slightly, a lot of the underlying causes are the same. And what we're going to talk about is what we need to look at from a functional perspective to address and help you recover from all three of these conditions. While ulcerative colitis and Crohn's are considered autoimmune conditions, irritable bowel syndrome is simply a diagnosis of exclusion, meaning that they've ruled those other two out and they really don't have a good answer for you. But what all three of these conditions have in common is inflammation. And the point I make with all of my patients is that digestion and digestive health has to be one of our top priorities, because if you have a digestive problem, it's not just about your digestion. It's going to affect every other system in your body, your endocrine system, your nervous system. If you have inflammation in your gut, you're going to have inflammation throughout the body and eventually in your brain, leading to things like brain fog, depression. So really, there is a lot of truth to the idea that all disease starts in the gut. So that's where we're going to look today. While traditional treatment of these conditions revolves around anti-inflammatory like steroids, and in the case of some of the autoimmune conditions, drugs or medications which suppress your immune system, which, by the way, can lead to the likelihood of increased risk of infections and certain cancers. From a functional perspective, what we want to do is do the testing, which has not been done, to determine exactly what the cause is for your particular condition, because it's not the same for everyone, and that's why a cookie cutter or cookbook approach to chronic health problems simply doesn't work. Because the only option is drugs or surgery, all the testing that is standardly performed revolves around how is it going to affect our treatment for you, which medication are we going to give you, or which procedure do we need to perform. So likely a lot of these tests we're going to talk about today have not been done, and if you suffer from any type of digestive problem, you absolutely have to have some of this testing done. The first test I want to talk about is a test, very new test, performed by Cyrex Laboratories in Arizona, that allows us to look at the integrity of your mucosal barrier system, or your gut lining. Ideally, this is what your gut lining looks like. These are individual cells that line the gut, and these little finger-like projections here are called villi. In between each of these cells are tight junctions made up of the proteins occludin and zonulin. What can happen is, due to stress, infection, poor diet, antibiotic overuse, alcohol, can break down these proteins and compromise the integrity of this barrier system, allowing dietary proteins, bacteria, yeast, or other things to pass directly between these cells and pass straight into the bloodstream, which never should happen. What this does is it triggers an immune response and a chronic inflammatory response, which over time causes things to break down further. So what this test from Cyrex Lab allows us to do is find out whether or not your immune system is making antibodies against these tight junction proteins, whether or not it is making antibodies against the cells itself, causing breakdown that allows things to pass directly through the cell. And last but not least, it allows us to look at whether or not you are making antibodies against lipopolysaccharides, which are a byproduct or a waste product of bacteria, which can form a sludge-like layer over this lining, leading to malabsorption. So if you have a digestive problem, this test is essential to finding out exactly what's going on with the health of your gut and what exactly we need to do to help repair it. Because if you have any of these processes going on, over time it's going to lead to more and more inflammation, and over time, if left uncorrected, neurodegenerative conditions as well as autoimmunity. Another test we want to do is look at the health of your intestinal flora, or what's living in your gut ecology, because there should be adequate levels of beneficial bacteria or probiotics. But when probiotic levels are inadequate, it allows opportunistic or pathogenic bacteria to infiltrate and overgrow, as well as things like yeast and parasites. So we do a test that is based off DNA analysis to find out exactly what's living in your gut. So are there adequate levels of the probiotics? Do we need to replace any of those? And is there anything that shouldn't be there that we need to remove? Again, opportunistic bacteria, parasites, or yeast we need to check for. We also can look at a functional analysis of your blood work to determine exactly what this digestive problem is doing to the rest of your physiology, your thyroid function, your adrenals, liver. If you have toxins building up, you can have a heavier burden on the liver. And that brings us to the third thing that we really need to check for in any of these conditions. And there's a lot of misinformation and misunderstanding about the subject of food sensitivities, particularly things like gluten, casein, and soy. These are large dietary proteins which can cause a lot of inflammation. Now, the point I really want to make here is that gluten sensitivity is not the same as having celiac, and they are not tested for the same way. So if your doctor says that he ran a test for celiac, it's not what we need to do to find out whether or not you're having a reaction or sensitivity to gluten. Cyrex Labs, again, has one of the most accurate and sensitive testing available to look at whether or not you're reacting to wheat or any part of that wheat molecule. So it's a lot more accurate at identifying those people who are having an immune-mediated inflammatory response when they eat things with gluten and wheat. But we can also check for what are known as cross-reactive foods. Maybe you have identified that you have a problem with wheat or gluten, and you've removed those already. A lot of people get better, but there's a subset of people who don't, because they're likely still reacting to other foods, known as cross-reactivity, things like potatoes, rice, coffee, chocolate. So Cyrex has a panel of commonly found cross-reactive foods which we can look at to find exactly what you're eating that is causing inflammation. Because I can tell you, if you have any of these conditions, it's highly likely, whether it's a cause or effect of a compromised gut barrier system, you likely are having reactivity or sensitivity to things that you're eating. If you continue to eat things every day that are causing you more and more inflammation, you are not going to get better. So by doing all this testing that, again, likely hasn't been done, or you wouldn't still be suffering to the level that you are, we can identify what foods are best for you to avoid and help you to design an effective eating plan. If you have an autoimmune condition, we can look closer at your immune system. There's two parts to your immune system. There's Th1 and Th2. Th1 is the army that attacks and cleans up afterwards. This is your T cells. Th2 are your B cells. They make antibodies, so they tag things to be marked to be attacked by your Th1 system. Now normally there should be some balance between Th1 and Th2. In autoimmunity, there can be an imbalance or a dominance in the immune system where one side becomes dominant over the other. So what we want to do is investigate further to find out if your immune system's been tipped out of balance so that we know how we can support you to bring balance and help to modulate your immune system. And this is the reason why it could be dangerous for you to take certain supplements if you don't know how your immune system needs to be supported, because certain nutrients, vitamins, minerals, herbs can support either Th1 or Th2. So by doing this investigation, we can be real specific, and then we can do some general things to help support and modulate your immune system while decreasing inflammation. So once we get an idea of what's causing all this inflammation by doing the accurate testing, we can provide you with nutritional supplementation to help repair and restore integrity to your gut. Now, by using this comprehensive approach, we have really fantastic results helping people with a variety of different digestive problems. It doesn't matter what we name it when we're addressing the causes. So if you are interested in investigating further how this approach could be the answer that you're looking for to recover from your chronic digestive health problems, please call our office to schedule an initial discovery visit and case review. Thank you for listening and have a great day.